am Dr. Adam Wilson with Steamboat Orthopedic and Spine Institute. In partnership with David Siegfried of Mountainland Therapy in Granby, Colorado, we have created a video series of home exercise programs. These videos are intended as guidance for patients who are unable to attend physical therapy visits or as a supplement to your physical therapy. If you are unsure if these videos are right for you, please don't hesitate to contact Steamboat Orthopedic and Spine Institute or Mountainland Therapy. The following video is intended for patients with low back pain or recovering from a low back injury.
An easy lumbar stretch is to perform double knees to chest. Bringing knees up towards the chest, lacing fingers or grabbing knees, whichever is comfortable, and holding that position. If this is difficult to bring both knees up at the same time, you can bring one leg up at a time, bringing it into place, and then bringing the opposite leg. A gentle rotation stretch can be performed by bending the knees and letting them relax to one side. Do not force the motion, let gravity do the work. Next, we're going to perform a marching in place exercise. Pick a cabinet drawer or a knob to aim for as you pick up your knee and literally march in place. Let's go ahead and perform a mini squat now. We want to rest our hands on the edge of the kitchen sink. We don't want to use the sink to pull ourselves up, but bearing the weight through our legs to perform the squat. We use a stable surface so that you can be comfortable and not feel like you're going to lose your balance or tip over backwards. Next, we're going to do a heel lift. We're going to bring our heel up towards our backside. Next, we're going to demonstrate a hip abduction exercise. So we're going to stand on one leg and bring the other leg out to the side. We want the patient to try to keep the toes pointed forward and not externally rotate. And we also want the spine to stay straight. We don't want to side flex or side bend in order to perform the abduction exercise. So I'll try to straighten out again. Back. Next, we're going to perform a toe push-up or a heel raise. So come up onto the balls of your feet. Very good. Now let's try to perform a single toe push-up or heel raise. Prone leg extension. Straighten the leg and lift the leg off of the floor just enough to clear the kneecap. We can alternate sides. We want to avoid overlifting as it puts stress and twist and pressure into the lumbar spine. Just lift enough to clear the kneecap off the table. If you cannot perform this, just activating the muscles as if you're trying to lift your leg up is enough. We can perform opposite alternate lifts by performing the previous exercise of the straight leg raise and adding an arm to it. So lifting the opposite arm and leg. Again, avoiding overlifting as that puts stress and strain into the lumbar spine. Next, we're going to perform a bridge. We tighten up our glutes, tighten up our stomach, and then bridge up. Trying to keep the legs parallel as we perform the bridge. We also don't want to rely on our hands for stability, so light pressure should be on the mat. Also, people will experience hamstring cramps a lot of times when they cannot activate their glutes. So by using your heels and pushing your heels into the mat will activate the glutes even further. Bridge with alternate leg kick out. Activate the glutes by squeezing, tightening up our stomach. We bridge up. Maintaining that bridge, we try to alternate by straightening out our leg, bringing it back. Object of this exercise is to maintain the height of the bridge while straightening out our leg. Step ups and step down. Try not to use the leg that is on the lower step. Use the leg that is on the upper step to lift our body as opposed to propelling or pushing off with the opposite leg. Transfer the weight to the forward leg. Try not to push off with the tiptoes and lift our body up with that left leg or the leg that's on the step. If a full-size step is too difficult, a shortened height step or patio paver books can be used in place of a full-size step to perform the exercise. Air squats or standing squats. Feet slightly shoulder width apart or slightly narrower. And keeping knees somewhat within the frame of the foot, squatting down. Arms can be used to counterbalance. Or to make the exercise more difficult, lacing the hands behind the head, squatting down as in a prison squat.